And welcome. My name is Dr. Lottie, and I'm going to be carrying out your full body medical examination for this evening. Okay, so please do come on through, take a seat, try and relax and make yourself nice and comfortable. And before we get started, just going to check all of the information that I have and confirm that with you. Ask you a few quick personal questions and then we can get started with the checkup. Okay, so can I just confirm your full name? Yep, great. And your date of birth? And your current address. Okay, wonderful. And in the last 12 months, have you had to visit the emergency room? Okay, any injuries or illnesses that we should be aware of? And any medical conditions? Any allergies? And are you on any medication currently, whether that's prescribed or over the counter? Okay. And have you been experiencing any of the following? Okay, so blurred vision, headaches, nausea, fever, dizziness or loss of balance, confusion, shortness of breath or chest pain, wonderful. Okay, so I think that's everything that I need from you, unless you had any concerns that you wanted to raise with me now before we get started. Or if not, we can just go ahead and treat it as a usual examination. Fantastic. Okay. So just going to pop on some gloves. We'll have a look at your vitals. Probably a size too small for me, so they're always a little bit tricky to get on. Okay. So, starting off by listening to your chest. Okay, apologies, this might be a little bit cold on the chest. I'm just going to lay that lightly there. And if you could just breathe normally for me. Good. Okay, just feeling your pulse as well. Good. Okay, now just going a little bit further down to the chest, listening to the lungs. Can you take a big deep breath in for me? Really fill those lungs. Good. And exhale. Okay, this time I want you to take a big deep breath and then hold for me. Okay, so breathing in and hold and exhale. Okay, let's have a look at the reflexes in your knee. Okay, so just got one of these little tools there. I'm just going to gently tap directly underneath the kneecap, and we'd expect to see a jerk reaction from the knee to indicate the reflexes are all intact. So just relax for me. Good. And then to get a reading on your blood pressure. So with this one, just going to wrap this round the arm, okay? And when we inflate it, it's going to apply a little bit of pressure, so a little bit of tightness around the arm, but nothing painful, I promise. And then we can remove it and move on to the next set of tests. So just wrapping around his arm. Thank you so much. Just going to take this off now. A little bit closer and have a look at your face. Okay, from what I can see, the skin is looking nice and healthy, which is exactly what I like to see. Okay, I'm just feeling the glands in your neck. Is that causing any pain or any discomfort at all? Good. Under the chin. Good. Okay, can you open wide for me? That's it. And say ah. Thank you. now looking at those eyes. Okay, so I want you to focus on me and me only. So pick a part of my face that you want to focus on. Maybe it's my eyes or my nose or my mouth, whatever it is. I want you to just try and focus on that point, ignoring the light. Good. Good job. Now just going to cover each eye, doing the same. And now just blink. Good, blink. Good job. Okay, now can you look up? Good, and look down. And look to your left. And then look over to your right. Good, and back at me. And again, look up. Look down. And look over to your left. And over to your right. Good. And back at me. Good job. Okay, now I want you to focus on the pen as it comes closer and further away. That's it. Just fixate your eyes on the pen. Good. And now follow that light. Okay, so where the light moves, your eyes should follow. Follow the light. Following. Good job. Okay, now let's do a quick vision test. So just have this handy eye chart right here. I just want you to tell me the letters that I'm pointing to. Okay, so this letter here. E, good. And then this letter. L, good. This one. D, F, P, H, O, L, C, good. F, B, E, F, D, H, J, L, T, good, nearly there, F, P, and finally H. Good job. Your eyes clearly working just fine. Okay. Now let's have a look in those ears. Okay. Over in this ear first. Can you hear me nice and clearly? Good. Okay. And what about over here? Can you hear me nice and clearly in this ear? Okay, good job. Alright, ears looking incredibly healthy, but as always I do just want to give them a quick clean. Okay. So good to know that you're not attempting to clean at home, but as you're in right now, then we might as well just give them a good clean together. And over in this ear now. Okay. Much better. How are you feeling, my darling? Good job. Okay. So, let's do a quick physical exam now then. Just going to work my way down to your stomach. Just applying some light pressure there. Is that causing you any pain, any discomfort? You're not having any problems in terms of your digestion? Okay. Good. Okay, what about your neck and shoulders? Any muscles in your body? Moving okay, no issues with your mobility? Good, okay. Let's have a look at those hands. Can you clench into a fist for me? Good. And finger to thumb. Good job. Okay, I'm going to take those gloves off. And before we part ways this evening, I just want to check in as well on your mental health. Okay, obviously we always check thoroughly how you're doing physically, but also really important that we understand how your mental health is at this stage also. So in terms of your mental health currently, how are you feeling? If you were to put that on a scale of 1 to 10, so 1 being absolutely fine, no problems with your mental health whatsoever, incredibly happy, stress-free, peaceful, and then 10 being the other end of the spectrum, so the worst your mental health has ever been. Okay. And do you feel that you have a good support system, support network at home? So circle of friends or family, colleagues that you would feel comfortable talking to if things did get worse? Okay, good. Well, if that changes, you know where I am. Always happy to be a listening ear, someone to talk to if things do deteriorate. Alright, great. So let me just finalise those notes. So, vitals, strong, normal. No concerns. Eyes is throat. Skin. And physical exam. Normal. Okay, great. So, my darling, that is everything completed for today's examination. As always, it's been a pleasure taking care of you and having you in here this evening. I hope you have a wonderful, wonderful night's sleep, and I look forward to welcoming